Thank you. My name is Michael Dimmick. I'm from Santa Rosa, California. I'm the president of Roots of Change. Roots of Change is the backbone organization for the California Food Policy Council, which involves 20 organizations from up and down the state working to improve the food system. I just wanted to say that we live in a time when many citizens struggle to understand the relevance of government to their lives. I think that the elimination of this contract, or this provision to allow the kind of contracting that's going on, will cut into the ability for people to really see how government serves them. And I'll give you one example. Last week we hosted a meeting with 30 regions of the state, people working in their communities to improve access to healthy food for children and adults, combating obesity. And we brought together 19 health departments with those leaders and set up for a discussion how they could work together to improve access to healthy food in their communities. And it was remarkable to see. The next day we did the same thing, 2 days in a row, these kinds of conversations. And it was very clear from those conversations in which I sat with local health department staff that they needed the connection with local community around real expertise and relationships that they don't have personally. So there is actually, in my mind, a real question about whether it is possible for someone who works in a government agency to be that close to the issues on the ground and to provide the linkages. And our role as a statewide nonprofit is to build that network, because there are 900 organizations in our network who are part of this effort, and that linkage would be lost without such a contract. Thank you.
Madam Chair, members, Matthew Marston with Public Health Institute. I'll just acknowledge we do have the current contract, and we've worked with the State Health Department since 1996, and we're proud of the way we have competed for the SNAP-Ed work and helped to build the program to what is today the nation's most successful and robust SNAP-Ed program. We are, however, opposed to this BCP, and it's not because we're trying to maintain the status quo. We have been working with the department, urging them to think differently about the way they contract at the state level with non-governmental organizations, now that the program and the federal funding has changed in recent years. But we are concerned at this BCP, and we're opposed because we think it would have a detrimental impact on the infrastructure in California. A couple of reasons why, and I'm just going to highlight a few. The first is that a successful public health program, much like California's tobacco program, has always been built on that partnership between strong state leadership, local agencies like the health departments, and then non-governmental agencies working in partnership together. This BCP would eliminate one of those key pillars, which is the work at statewide NGOs working together. And that's critical for a number of reasons. One is, as the state just acknowledged, this BCP would create generalist positions. PHI and many of our partners that contract with the state work on the open market, work with community-based organizations. We go out to find folks that have high levels of technical expertise that you cannot find in state service that would be lost through this BCP. Secondly is that ability to be nimble and flexible, to leverage other resources, philanthropy and other dollars that aren't restricted by the USDA funding, and be able to, as we fight this obesity epidemic in California, to be able to confront some of the challenges from the industry that's battling against us as we fight obesity. As already mentioned, this BCP would eliminate 50 contracts to nonprofit organizations. So thank you very much for your support. Staff's time. Thank you.
Hi, Kathy Van Osten, representing the California Association of Food Banks on behalf of MVM Strategy Group. Just want to echo the comments of those who testified just before me. We agree. The budget change proposal, the BCP, we're just opposed to it. We believe that the relationship with the locals, on the ground, the folks that really know their local community, it's working efficiently, and we'd like to see that stay in place.
Thank you, Madam Chair. Christina Gunn with Brand Meta. I come from a Fortune 50 company, but I'm now also a small business owner, and I too struggle with the budget, issues of running a business. But I like to caution this group in moving forward with this transition, because moving to a mass organization reorg, you guys have to also consider some of the followings in terms of increased staffing needs, the downtime that you will have in ramping up qualified staff and certifying them, and also, the production that you'll lose and the effectiveness you'll lose and trying to replace. I honestly don't think it'll be done within 6 months, if not even 8 months, but that's just my experience as a business person. And lastly, some of the things that I like to also impress with this group here is that the tobacco control program is an award award-winning program, and it was done in partnership with state, local, and nonprofits. The SNAP-Ed is one of the programs that California should be very proud of, as other states are also modeling after us. And so that's something that I really like to make sure that I impress on you to, let's replicate success. And this is an ecosystem that's working. Thank you.
Thank you.
Madam Chair and members, Brendan Tuig on behalf of the American Heart Association, also the California Center for Public Health Advocacy. We have concerns about the proposal, particularly in light of the concerns raised by the USDA that are mentioned in the staff analysis. We need to be really careful. We don't want to do anything that would put this critical funding at risk. And we also need to be assured that will continue without interruption to effectively reach the hard-to-reach population. So we appreciate your continued diligence in looking at this issue.
Thank you.
Good afternoon. My name is Chris Boynton, and I am a director at Alameda County Office of Ed. I represent about 44,000 of the most underserved students and their families in the county. For the last decade, I co-built the network with the Health of California with CDPH. With their first administration changes in funding, they eliminated all of our funding, 32 schools, 27 school gardens, and a couple of farms. With this BCP, I see the elimination of the rest of our funding, the transitions that we have put in place for creating a career pathway for young folks, food career professionals, will be eliminated. And we strongly oppose the BCPH because we don't, PH, okay. Because we think that, along with the rest of our fellows here, that the local communities will not receive the funding, nor will innovation projects be implemented. Thank you.
Thank you.
Good afternoon. My name is Susan Forster, and I'm a 40-year former employee of the California Department of Public Health, where I led the development of two large campaigns. One was the California 5-A-Day campaign, which is now a national initiative with the produce industry. The other is a network for Healthy California. Under my leadership, we built the network from about $2.5 million to $120 million. And that was per year from the federal government, and we pulled in an equivalent amount of indirect, state share at the same time in order to qualify for those federal funds until the statutes changed a few years ago. This model was built on a balance between state employees and contract employees in order to build a strong social marketing component. So I'd like to address several points. Number one is the staff already identified that the government code allows for contracting out. In addition, there are two statutes, one from 1991 and one from 2011, which specifically speak to flexibility needed for nutrition. Number two, the large-scale social marketing initiatives reach populations that are in need and require highly specialized technical staff. The contract staff that are hired now have backgrounds that are very distinctive. They are very exceptional, all the way from child development to agriculture to community organizing and so forth.
Could you sum up, please?
Yes. So this BCP would not provide that continuation. Third, many of the campaigns that you're probably familiar with, African American, Latino, Harvest of the Month, are staffed by these contract employees. Those contracts would go away. Fourth, all of the small contractors would go away. Thank you.
Thank you.
Hello, I'm Genoveva Islas. I'm the director of the Central California Regional Obesity Prevention Program, and I'm also the current board chair for the Latino Coalition for Healthy California. And CROP, as our program is named, has been working for the last 8 years in the San Joaquin Valley to address obesity. Our model has been an inclusive model of partnerships with public health departments and community-based organizations. And I'm here really to speak out against this BCP change because although the funding coming to the health departments is needed, these health departments also need community-based partners to work with. They can't do this work of obesity prevention alone. We're at a time where we're seeing a strive in addressing obesity, and it's really a time where we need to scale up efforts and not consolidate them. I also feel and want to express that we are a technical resource center that's been awarded funding through NEOP, and this is a year-long grant. However, there's been a 6-month delay in getting this contract signed, and we're still waiting for our contract. So I feel that this sort of larger bureaucracy would be an inefficiency in terms of really getting money on the ground to do the work. Thank you.
Thank you.
Good afternoon, Madam Chair. My name is Claudia Corchello, and I am also with the Central California Regional Obesity Prevention Program, but I'm specifically in Merced County, so I am one of those community partners that does a lot of the grassroots work in our communities, but we work a lot with our youth. And in each of these programs, we really are forgetting to create these opportunities for young people. We keep losing all of these summer youth programs, and any opportunity that we get as a grassroots organization, we include youth. We put in stipends, lunch meetings. We have a little small group in the community of Planada that started out with a little subcontract with one of our partners. 3 years later, we continue to work with them because the work is still there. We just don't leave once the proposal or the grant is over. We continue to do the work because we just don't outreach in those communities. We actually plant ourselves and grassroot ourselves in those communities to help them out. Thank you.
Hi, my name is Jessie Gill. I'm with the Community Food and Justice Coalition. We're a nonprofit that's been receiving technical funds to provide technical assistance to local health departments over the past 4 years. Through our technical assistance work, CFJC's witnessed firsthand the success of and value of the private-public partnerships to affect the type of sustainable changes that our local health departments are charged with achieving. Statewide nonprofits and community-based organizations play a unique role that health departments have consistently relied upon us for, and that we have the expertise and flexibility to fill that specific need, a need which we've seen play out repeatedly where health department employees run against barriers that are inherent in government structures. This is a need that the state health department officials will not be able to fill should the CVP be adopted. Discarding the authentic connection with community and well-established relationships that have already been developed is something that's too valuable for us to lose. We're making such great progress. So we urge you, the Community Food and Justice Coalition urges you to reject the PCB currently on the table and continue to engage authentically with community. Thank you.
Hello, my name is Calvin Hedrick, and I am Mountain Maidu from an American Indian tribe here in California. And I work with a lot of tribal programs from all over Northern California, from the Northwest Coast to my home in the Sierras down to Southern California. And we are opposed to this, to the BCP, because we appreciate, for a long time, American Indian people have been asking for our voices to be heard, and through these subcontracts with CBOs and with small nonprofits, our voices have been heard, and we do appreciate that, and you know, we do appreciate the work that is being done, and we would hate to see those contracts go away. So, thank you.
Mario Guerrero with SEIU Local 1000, representing potentially the insourced staff. And someone who has a background in nonprofit, you know, I really don't like the way we're kind of going in terms of, you know, who can do the job better. Certainly there are benefits to having a state workforce and nonprofit workers. I think that as a local, we believe in you know, good, right, the appropriate level of contracting out, and so I do want to appreciate the fact that we're having this conversation. We do believe as a local that that the budget contains many of these instances where we're looking at, is it appropriate to contract out, and so I'm glad this post is still open. I would love to have a conversation with the department, with some of the advocates. At this moment, we are supporting. Thank you very much.
Hello, my name is Michael Blair, and I'm part of the NEOP African American Campaign Advisory Council, and I've been working with this group for about a year now, and I think without these contracts we're going to lose a lot of momentum. This group has spent 15 years building relationships with the African American community, specifically with the churches, and they aren't very trusting of government organizations, and so building that trust and building that relationship is extremely important. And I don't think that with this new proposal that they'll be able to address the specific needs of the African American community. So appreciate your consideration to keep the contracts. Thank you.
Hello, Madam Chair and members. My name is Marilyn Briggs. I'm here as a concerned citizen with a very strong concern for the health and well-being of those served by the program. I also have over 40 years of experience in the state bureaucracy. I'm a registered dietitian and also have a doctorate in nutritional biology. If you already have a program that's working, which took years of work to develop and implement, in addition to establishing trust with the funding agency, I don't understand why you would want to change it. I echo the concerns of all those who have testified, and after studying this proposal, I really feel that we would be taking a giant step backwards and really hope that you will oppose this BCP. Thank you.
Okay, I think that concludes the public hearing. Any other comments?
Well, we are going to hold this open, it appears.
We are.
And I do think it's unfortunate that we have this apparent conflict that's been created. It seems as though driven by some legislation from last year that may not have been framed as well as it could have been. And I appreciate Mr. Guerrero's comments in particular in that vein. I do wonder, as long as we're going to hold this open, whether an avenue available to us is to explore some modification to that legislation that would help resolve this apparent conflict. So I'm now going to speak against what I spoke for earlier, which was leaving policy in the policy process and not in the budget process, and say here we are talking policy in the budget process, but that was then, this is now. So I just offer that. It could be done in the policy process too, just not as quickly. But I offer that as a thought as you, Madam Chair, and the staff try to look at this issue in the weeks ahead before we take final action.
Madam Chair, I'd just like to express serious doubts about the proposal. First of all, if it was unconstitutional, it's been operating for many, many years unconstitutionally, apparently, for this type of contracting to take place. And secondly, it's apparent to me that there's a whole lot of community value in the existing program. And I think the burden is to demonstrate that that's not going to be destroyed and have to start over and build something new when you've got something that's been appears to have been working. So those are my doubts. Thank you.
This is kind of an unusual situation. Normally when we think of contracts and things that are in-house versus the contracting out, it's usually the other way around, where we have things that are already in-house and we're trying to push it out on contracts, and so that's always a negative. And now this is a situation where we have a number of relationships that are kind of external, and we're trying to pull them back in, so it's really a strange response to the normal situation that we find ourselves in, because most of the time it's the reverse. So I think we have to look at it very carefully. One of the questions will become, how effective are we if a significant portion of this is community outreach, being in those communities, having people who have the expertise in those neighborhoods and the communities to provide the services under our coordination. Do we become effective if we bring everything, or most of that, in? And even if we establish some relationships with them, it would be interesting to know what relationships we're talking about. And how effective that would be. So maybe you can share that with us if you know. It just seems it is a difficult question. Yes.
Yeah, we're not eliminating the overarching spectrum of community-based organization partnerships. We are expanding it with local health jurisdictions. The savings of $12 million that we're realizing from this proposal is the vast majority is going to local health jurisdictions, of which we are requiring, based on their threshold and size, to go to community-based organizations. We're funding over 180 community-based organizations currently, and that will be ongoing with this proposal. They're going from 70 positions that are not community-based organization contracts to 58 positions. The 45 you see here in this proposal, plus the 13 I talked about earlier on the CSU-UC. So if you're looking at apples to apples, it's positions, it's 70 to 58, and the savings we're pushing over to local health jurisdictions to CBOs. It may not be the same community-based organizations, although I bet you there's some overlap. And you heard from the testimony that some that are currently funded sound like they're not going to be funded in the future, but 180 of them are. And so I think that that's something that I would hope that the subcommittee just consider ongoing. This contract does expire at September 30th, of which we will probably have a very difficult, if impossible, challenge to renew based on internal interpretation of the law and working with the Department of General Services. That was all I'd add at the end here.
Okay. Any other comments, questions? All right. Well, this will be held over, so thank you very much, and hopefully we'll get a lot more clarity about exactly what we're losing, what we're gaining, where the savings are coming from, and those kinds of things that will help us make a better decision. So the staff will probably be working with you. Okay? Thank you. We're now looking at the WIC program.
Madam Chair, members of the subcommittee, I'm Daniel Kim, the Chief Deputy Director for Operations for the Department and the Acting Deputy Director for the Center for Family Health. With me is Chris Nelson, the Assistant Deputy Director for the Center, and she will be presenting our WIC estimate.
Thank you very much for the opportunity to speak to you today about the WIC program. California currently serves 1.4 million participants in the WIC program. These women and their children are the focus and priority of the program. We provide services to these participants through local agencies and the vendor community who are critical partners in delivering the services. The program receives federal grant funding from the USDA and also rebates from the contracted infant formula manufacturer. The federal grant is received in two parts: food and NSA, which is the Nutrition Services and Administration grant. For the food grant, WIC pays these funds to the 4,500 WIC authorized stores for reimbursement of foods provided to the program participants. The federal budget for federal fiscal year 2014 was signed in January after this estimate was released, and the actual WIC appropriation is slightly more than reported in the estimate, an increase of $1.5 million. For the NSA grant, these funds are used for state operations and direct services provided by the local agencies in 650 sites in California serving the 1.4 million participants. Direct services include nutrition education, breastfeeding support, referrals for other health services, and of course their WIC vouchers. Since the federal budget was signed in January, this grant received approximately $800,000 more than what was reported in the estimate. WIC also receives approximately $248 million each year in rebates for infant formula. The drivers of costs are primarily two factors: utilization and reimbursements to stores. Utilization is measured by our program participation, and we've seen a slight decrease over the past year, which is consistent with national trends and the lower birth rate over the past year, which has had a cumulative effect since WIC program serves children up to their 5th birthday. The reimbursement rates for stores were lowered at the end of May 2012, and therefore in state fiscal year 12-13, we spent much less than what was projected. Note that these unspent funds were critical for California in continuing operations in October 2013 during the federal government shutdown. Other states reported that they had to close or significantly reduce services, and California was fully open during that time. These lower reimbursement rates are still in effect now and resulted in a lower projection for state fiscal year 13-14 than had previously projected in last year's estimate. Approximately $77 million less in 13-14 than we had previously projected. I can also provide an update on the work we've done on the vendor reimbursement system. As you know, we've had a federally imposed moratorium in place for 2 years so that we could address increased food costs and program integrity concerns. We have made substantial progress to address the full spectrum, including implementing interim reimbursement rates to immediately reduce costs, adjusting what foods were authorized, how stores are authorized, our oversight efforts, and our last step is the vendor payment system, which includes peer groups and reimbursement rates for each peer group. USDA has given us approval on each component as we have moved forward. California worked closely with USDA last year to finalize the vendor payment proposal and post the regulations for public comment in December of 2013. We are now reviewing those comments and determining where it is appropriate to make adjustments, and will have to seek USDA approval for any changes to the proposed regulations. We plan to post the final action by April 1st of 2014. The effective date of those regulations will be approximately 2 months later to allow final IT programming changes to our system that calculates the actual dollar amounts for each of the WIC checks, and to provide notification to the vendors of their new peer groups and reimbursement rates. After these regulations go into effect, we expect the USDA to approve lifting the moratorium. We do expect that USDA may want a phased-in approach, but we don't have any information from them yet on that. We are very motivated to complete this work and lift the moratorium, as is the USDA. It's a high priority not only for the WIC program, but for the department and the administration as well, and we are fully committed to this effort. I can also provide an update on the WIC division chief. The WIC program is so critical to California and it's very critical that we find the right person for this position. We have just closed another round of recruitment on February 28th, and the department is now reviewing applications and will complete the process as soon as possible. I'd like to assure you that even though there's not been a permanent person in the position, there certainly has not been a gap in leadership for the program. This program is a high priority for the department and the administration, and executive leadership have been very involved in ensuring that we are able to address all the issues that are needed to successfully lead the program. Thank you.
Okay. Thank you. Any comments from LAO, Finance? Any comments up here?
I'm sorry, I just wanted to make sure I followed the timeline leading to the expected lifting of the vendor moratorium. So you said regulations, you anticipate April, and an approval roughly within 2 months, or was it March?
We expect to have post them at the beginning of April, and we would need USDA approval before we post, and then they would go into effect approximately 2 months later.
So maybe mid to end of June.
Yes.
And then was there an additional lag?
No.
Then you expect that to lift the moratorium, but you talked about perhaps a phase-in of some kind, or a graduated approach on designating new vendors. Is that what you were referring to?
Yes, it's possible that USDA may want to phase in, as they have done in other states in the past.
So what has that looked like in other states?
Typically, it's what's called an add to master is the first stage. So any stores that have an existing vendor agreement would be first. So existing chain stores or small stores that already have WIC locations and are familiar with the requirements of the program, have gone through the WIC training, that sort of thing, would be authorized first.
Okay, so it would be good, it seems to me, if the subcommittee was kept apprised of the progression so that we don't lose track of this, because I know in the community I represent, there's a great deal of concern about vendors who've been unable to be authorized. So it would be good to know that when that moratorium is lifted and there's progress toward authorization of new vendors.
Okay. No other comments? Any public comments?
Madam Chair, members, Lori True, Executive Director from the California WIC Association, and my principal constituents are the local WIC program staff who operate the programs in all counties, 84 of them, and we are very supportive of the state's progress this year. I know it's been a long wait, and people are very impatient for the moratorium to be lifted, but I've read the regulatory proposal that's hopefully going to be finalized by April 1st. It is very comprehensive, and it's an elegant solution to a very complex problem, which is probably worth the wait, although the stores probably wouldn't agree with me. And my constituents are mostly eager to get back to the real work of WIC, which is to protect the health of women and children through nutrition and breastfeeding. We do want to see a brave new WIC director leading us. Leadership is important. While we appreciate the incredible stepping in of executive staff from CDPH to make sure we don't go off course, and we're eager to get back to our real work. Thank you.
Thank you. Okay. Hearing none other, this item is going to be held over, so thank you very much for your comments. We're now at the Licensing and Certification Program Estimate, item number 4.
No, it's okay. It's okay.
Yes, thank you.
Hi, good afternoon. This is Madam Chair.
Can you hear in the back? They can hear you. No, you can?
Good afternoon, Madam
great.
Chair, committee members. I'm Kathleen Billingsley. I'm the Chief Deputy Director for Policy and Programs at the Department of Public Health, and here to speak today on licensing and certification. Joining me is Maria Gutierrez, who is the Chief over the Fiscal and Administrative section, and then joining me for discussion of the BCPs is Scott Vivona, who's the Interim Assistant Deputy Director for the Licensing and Certification Program. Thank you.
Okay.